Surgical decision making is probably the hardest part of spine surgery. Figuring out not only what your goals are with surgery, but also how you're going to achieve them and then individualizing that for every patient. That's kind of the art form of spine surgery and why there can be so much variability in the different treatment plans surgeons will come up with. But surgical decision making, what I teach our residents and fellows, it always starts with establishing your goals and those goals being individual for every patient and their anatomy. Given that, I really use the rule of 4 pillars. These are 4 pillars that I teach. There are, of course, other considerations, but the 4 pillars of spine surgery or surgical decision-making are decompression, stabilization, arthrodesis, and alignment. So in decompression, I really encourage people to think about specifically what are you decompressing. Like, is it the spinal cord, is it the nerves, is it the right C6 nerve, is it the left L5 nerve? But be clear in your mind about the patient's symptoms and what you're trying to decompress. So you start by laying out the goals from a decompression perspective. Then I think about stabilization, and not every patient needs stabilization, but if you're going to stabilize it, you want to think about how are you going to achieve that and what's the relative merit of different approaches. You can use pedicle screws, you can use cortical screw-based trajectory pedicle screws, you can use anterior plate, but how do they all compare? Stabilization is the second thing to think about in isolation. It's never enough to stabilize the spine, you also have to achieve an arthrodesis. So you have to think about how is the bone going to heal because the hardware will never last forever. So understanding how you're going to achieve an arthrodesis is the third pillar. And then the last is alignment. And I think our understanding of surgical and spinal alignment has changed a lot in the last 10 years. I think about alignment on every single case. A single level fusion, you should be thinking about alignment. What is your global alignment? What are the spinopelvic mismatch parameters in the lumbar spine? Cervical spine's all the same. But thinking about alignment and what you're going to do to it with surgery is imperative as well. So the 4 pillars that I always emphasize are decompression, stabilization, arthrodesis, and alignment.